Because with abstract writing, you begin to showcase your technical expertise. You know, some of us, we are working in this Best Health organization. And then from there, when you are fed up with that organization, you want to leave. We want to just jump out of the organization. Not say that you should do that. You want to just jump out of the organization. And the easiest way to get a reference without obtaining a reference, if I'm an M&E person, is just to have a CV that has got lots of abstracts and lots of articles. They might end up not even contacting my supervisor who was supervising me, because they can see the output is there, the output is peer reviewed. It shows that I'm a researcher. It shows that I've done exceptionally well in that particular space. No one will end up saying, let's just contact the supervisor, who the previous supervisor who was under this particular person, and then they'll just say maybe the problem was with the supervisor. They couldn't retain this particular individual. So which means through abstract writing and article writing, we're in a position to document something that we can live with it for the rest of our lives. And also, if I begin to write an abstract with you, we build a long-lasting bond. Because all the time when people, they are citing you, when they read, they will find me in that particular abstract. Even if you can't remember me, I'll tell you that, oh yeah, you remember me. The one that we wrote that abstract together, or your co-author. You see? And all of those things, they build long-lasting relationships. So here I'm talking about it at a personal level. Because most of these things that we do at our workplace is not like we really like doing them. We just do them because we just have to do them, and because the donor wants us to do them. But without internal motivation to do them, the chances of us doing them, they are very minimum, considering the fact that you end up not being paid for you to do that work. So the question is, but why would I write abstract at a personal level? So you will find that the actual benefit of abstract writing is not so much at an institutional level, it's a lot more to do with at a personal level. You as an individual, you get to benefit from that particular process. But of course, since our organizations, they allowed us to be here, this is what we tell them when we get back to them. We then let them know about the fact that the Global AIDS Strategy, the current NSP, the PIPs, they all talk about a community-led AIDS response, which talks about the fact that communities need to be taking center stage in the work that we do. Key populations need to be taking center stage, but not only that, they need to be the ones that are leading the documentation and dissemination of the work they are implementing. Not a situation whereby someone external comes through and then from there they begin to say that now I'm a key populations expert, or now I'm in this particular space expert. Because there are lots of kind of opportunities that are going to be coming up in this space, in the NGO space. And you would want a situation whereby relevant people with lived experiences get to take center stage in that particular work, whereby you can get there and show that, in the space of GPV, I've written abstracts, I've written articles, look at my CV. You might not be having your master's and your PhD, but all of that might equate to someone looking at it to say, this person has got lived experiences, they know the community, they know the terrain. They might not be having a master's or a PhD, because that's a competitive process. It's something that talks to resources. It's not like all of us were well resourced for us to go and pursue further studies. Some of us, we came from child-headed households. Some of us, we came from all of those kinds of disadvantaged communities. And there is no way that all of us who could be doctors and professors at the same time. So there's a part that says that we want to build these aspects so that we can take a leading role. And communities are the backbone to the AIDS response. All right. So communities advocate for effective action regarding community needs, and they can plan, design, and deliver effective services. So when it comes to program design, the real people that know how to design programs are actually sitting in communities. And then the real people that know how to document what has been designed, of course, they're sitting in those other offices. And then from there, they receive that big money, and then from there, they give it to the ones at the bottom. But what if we begin to build those community-based organizations so that they would be in a position to say, in future, their teams might be the ones that are actually taking a lead in that particular process of receiving the big monies, planning for them, designing programs, and actually delivering those particular programs. And that is a possibility. It might not happen this year. It didn't happen last year. It might happen next year or the following year. But we should die trying or pushing in that particular direction. Communities also advance the realization of human rights and support accountability monitoring of the AIDS response. It is important to realize and amplify the importance of having community-centered and community-led approach through giving CPOs a voice in conferences. So like I said, one of the things that actually drove to all of this is the fact that you would find that community-based organizations, they do exceptional work. You know, the quality of data that you get from the community work that gets to be done by people that are practically implementing on the ground, it can never be compared to the quality of data that is done by a student. When a student comes to interview your community members, there is that, distance and understanding of the community. But if yourself, you are engaging with that particular community, you collect quality data. That is why some students, they will come with resources, they give it to an organization, and then from there, the organization collects the data. Because they themselves, they know to say that in terms of quality of data, they can never match the quality of data that you guys can collect on the ground. And now we're saying that no, it's not just about you collecting the data. We want you to collect the data and to document that data and also present that data because it's your data. So we want a situation whereby data gets to be owned by people from the communities and they take a leading role and their voices are heard. But not only heard this year around. We want to take it to abstract writing. From abstract writing, we go to article writing. So we want that phase of moving in this direction. Not a situation whereby we've gone to conferences, we've enjoyed the hotels, we've enjoyed, and then from there it ends there. Or fine, we're going to enjoy the beach and all of that. But we want a situation whereby those pictures, they even appear now when it's time for article writing. To say, oh yeah, we were at the conference and these are the articles that have come out from there. The other reasons why community-based organizations give voice to people who are often excluded from decision making. So, if you are not documenting best practices and some of the challenges that are happening in your communities, you're actually doing a disservice to your communities. Because the nature and type of funding that you would receive is determined by the best practices that you are having. It's determined by what are the challenges that are faced in the communities. And so, which means if we don't document, it's going to be difficult for the funders to know about our work. But if we document, we go to conferences, we tag relevant funders. We then go in, we write articles and abstracts, we share those best practices with relevant funders. And then we keep on sharing. Because like from an article, you can take a paragraph, you share. You take another paragraph, that was a hit, you share. You come up with another change, you share. When it comes to things to do with national, provincial, policy and all of that kind, you say, yeah, you know what, in Free State, there is this article that we did, or there is this abstract. So you don't just say that, we can do this intervention like this and this. Like, no. You must start off with an introductory statement that says that, oh yeah, in Free State, in the last TP conference, in the last PASA conference, there was an abstract. One of the 15 abstracts that we submitted was on. So it gives that background before you hit to say that, this is the actual thing that I would want to say. So it brings in a different picture in terms of the work that you do. So there is a part that says that we need to make it a point that the people that are in the communities, they end up featuring in some of this abstract writing work, in some of this article writing work, so that we showcase the great work that they are doing. The AIDS response should have a community-driven and a community-focused approach so as to drive sustained change and transformation from a grassroots level. The truth of the matter is that at a grassroots level, that's where most things are happening. And that is where most of the changes are happening. That is where most of the continuous quality improvements, initiatives, they actually rolled out, without them being classified as continuous quality improvement initiatives. But there is no way that today I can see that I don't have money. And then tomorrow, I stay without money. I hustle. I come up with other innovative ways of doing it. I see that I've got this particular sickness here. I go and consult my, my traditional healers. I go and consult my uncles. I consult. And then from there I move. I consult my friends and all of those kinds of people. So there is a part that says that there is a lot of continuous quality improvement, a lot of thinking that goes in at a community level, that goes undocumented. And those thought processes, it's only us who knows about them. And this will also translate to documentation of best practices at community level, active involvement of key populations focused on key population-led organizations will almost likely translate to increased uptake of health services. So at the end of the day, we want to come up to a point where we've got increased uptake of health services. And then when should community organizations or these teams start writing the process, these abstracts? So the truth of the matter is that, you know that we can start writing an abstract before you even start a project. Like, for example, we can have an idea right now to say, you know what, we should do this and this. And it's the three of us here. And then we say that we're at a triage. There's something called a triage or a dialogue. Maybe the 12 of you. Or is the guys that are part of your management team you're discussing. And then from there, you go on to document that, you know what, we had a discussion, say that it's a key format interview discussion, or it was a dialogue. We held one dialogue as a team, and we decided that this is what needs to be done, and this will be a best practice. Everyone in the team agreed that this will be a best practice, because this thing will lead to this and this. This is at the stage where you have not even written, we have not even implemented your project, but it's an idea that you are having in your mind, and you want to sell it as a best practice. But you then document it in such a manner that it shows the consultative process. To say that, no, there were 4 key informants who were there. And those key informants, one of them, you know. And then from there, you then say, based on those key informants, this is what we learned in that particular process. So these are like unique ways through which we can document best practices from a community-based perspective. When the project starts, so this is one of the key things to say that when the project starts, you find that there are lots of inception meetings. You know those parts whereby you're going into a community and they've got challenges. There are all these the red tapes that you are passing through and all those challenges. Now, have you ever searched and found a document that talks about red tapes and the challenges that you're going to face when you go to Free State? There's nothing like that that is documented. No one has written an abstract about the challenges of entry into a community and how to circumvent them and how to minimize those challenges. No one has written that. People are not writing those things. Yet those are the things that are happening. They might not state Free State, but they can state that when you're implementing this kind of a program, this is how you need to do it in this particular community. These are the key people that you need to talk to in this community so that this thing can move smoothly. You will find that I talk to this one is not the relevant one. I talk to that one is not relevant. I talk to that one is not relevant. And then I talk to that one, and then finally suddenly everything opens up. So when people get into a community, when they're out there, they do a search online. You know, how do we access this particular community? And then they say they don't find anything. What do? They come. When they get to this community, they start knocking on all doors. So they think that this thing must go to Department of Health. They go to Department of Health. When they are within Department of Health, they've gotten all the approvals and everything. They discover that no. This is a community issue. You know, you should speak to this chief for this community. And then this chief will take you to this one. And then this one will take. Then when they are done with all of that, like, no. You could have spoken to the secretariat. They are the coordinating mechanism that is in charge of all of it. Like, oh, but now it's 6 months down the line. And they've wasted project time. So this happens when the project starts. All those inception meetings, you know, what are the key things, the key learnings that we're getting from there? When the project is being implemented, then of course you're collecting data now. You're writing your reports. You're having all those monthly and weekly meetings with your teams. So you might find that every Friday when you're having those weekly meetings, potentially there could be an abstract that is coming out because there are lots of best practices, lots of learnings that are coming out from there. And what are you doing? You're creating a culture of writing within your teams. One day you will wake up. There are people that we met like 2 or 3 years back, some of them a year ago. Some of them are even telling us now, say, you know what, I'm now pursuing my master's. You know, or I'm completing my honors. They're like, yeah, you know what, you guys, you motivated me. So which means there is a possibility that you might change some lives in your teams if you begin to say that, you know what, actively participate in this abstract writing process. They might be bad in writing your reports, but they will not be bad in putting together best practices within your team. Because they know what is happening on the ground, but they might not be in a position to write. And that is the punishment that most organizations, they end up facing. To say that they are not in a position to write, but they're in a position to see this is a problem in the community, this is how we solve it, this is how we solve it. So you get them to be part of the team. They talk, other person writes, the other person records. And then from there, we provide support to that. When the project has ended, how many projects have ended? How many abstracts have been written? So which means when it comes to abstract writing, we can write our abstracts when the project comes to an end. So there is a lot that can be written there. So what does this mean? It means that anytime in the project life cycle, we can actually write some abstracts. So, characteristics of these abstracts, they must be accurate, coherent, and readable. So it must be something that is easy to read. So, trust me, abstracts are not complicated. Because if they were complicated, we wouldn't be having so many community organizations going to conferences. We have situations where we get 54 abstracts going to a conference. For the SA AIDS conference, we had something like the last TB conference, we had 54. For the PASA, we had 47 abstracts going to a conference. For international AIDS conferences, we've got 30-something abstracts going to these conferences. And it's a situation that says there is nothing complicated about the abstract writing process. It must be concise, specific, and also selective. So when you're going in for something, you just write about that small thing that you are doing. You don't worry about the other things that are there. When it gets to be accepted, now you're in the platform. Now you can begin to talk in English. If English disappears, you shift to another language. When that language disappears, you shift back to English. Because certain things are difficult to explain. And people would understand that, you know what, here they are community people. You know, and you apologize along the way. You say, sorry, I ended up translating, you know, and then from there you go back. But these things are very difficult to explain in English. And people are going to be fixated in your work. They will ask each other in terms of, you know, but what was he saying there? You know, but they are going to learn in that particular process. All right, so there's no need for tables, no need for references. You know, few abbreviations, words like HIV, ART, those are the things that we put there. And then the conclusion should be based on the data. Just to jump straight into the actual abstract, yes.
On the non-tables,
yes.
How do you present the results of the abstract itself?
Okay. So there is a point that says that there are no tables. There's only for tables. So the actual abstract writing is something like 300 words. And you narrate about the fact that there were 27, which is 30% of the people that did this and this and this and this. So it's just a narrative format. I'm going to be showing you some samples of those particular abstracts, most likely in the next slide, so that you can see a picture of it. But now, so the questions around the tables, right? So at the submission point, which is the 31st, we're not going to put tables. But at the time of presenting at the conference, then there you put tables, you put pictures. If it's a presentation, you can even play some music. You can do whatever that you want to do, as long as it's within the time limit that you have been provided. You can add more flash. You can even get there with your core facilitator. You know, where this person takes this first slide, the next one takes the next slide. As long as you're not gonna, you know, yeah.
Actually, my question was similar to the question of my colleague here.
Sure.
I wanted to check, is there specific guidelines or are there specific guidelines of writing an abstract?
Sure. So each conference has got specific guidelines. So you find that this SA AIDS conference, the guidelines are there on the website. Yeah. But for now, I'm going to talk to you about abstracts from a generic perspective, a simplified generic perspective. These notes that I'm sharing with you and some of this additional information is not really the process of doing it. That is written there. So I'm trying to move you from where you are to the point where you say, you know what, even myself, I can write an abstract. Right. So we're trying to tone down the technical jargon that is on the website to say, you know what, this thing is doable. Anyone can do it. But how do we do it? We all work together in that particular process. And then from there, when you receive your final product, you then say, I'm a researcher, you see. And then when you go and present, you get that confidence to say that, yes, I'm in the community-based organization space, or I'm in government, or I'm in this particular path, but I could have been a researcher, or I am a researcher. So key, these are some of the headings that always appear in abstracts. You know, there could be background, where you summarize the purpose, the scope and objectives of the program, project, national policy, and the gaps to be addressed. So you'll find that here, the background, it's like 2 or 3 sentences in terms of the actual writing, whereby you're just talking about maybe a broad picture around that particular subject, and then you're going on to talk about maybe the objectives of that. So it's not like a lot of writing. Now, like I said, when it comes to that session where we're going to be talking, I don't want us to have these sections in mind. Here, I'm just showing you this so that you can get a picture of the sections and what goes into it. When it's time for the talk session, I want us to just think of ideas that you are having. I don't want you to start telling me, yeah, the background will be, or the description will be, or the lessons learned will be, and what will be. Just talk, like you would normally talk when it comes to your programs. And then based on that, we then synthesize it into these particular headings based on the conference requirements. Then description of the program. Some of you have got 3-4 pages of description of your programs. And now we are saying that write 2 or 3 sentences. So which means you then begin to explain your intervention in a short and concise manner. Now you might struggle to summarize that, but it's a situation that is saying that we need to come up with ways of doing that, and we're going to be guiding you around that. So you talk about the project policies, the settings, location. So these are some of the key things that you need to talk about, where you mentioned that it was in Free State in this particular area, so that people would know, because this is the SA8 conference. You want people to know about your district, the activities or the interventions that were done, the lessons learned, presented clearly. So we need to talk about what are some of the lessons that we learned in that particular process. All right. And then from there, you draw the conclusion, the significance of your findings. So in some cases, we say policy implications. So there are all these different terminologies that I use. But this is just the generic way of doing it, particularly when we talk about projects or things that we are doing at a community level. All right. And one of the key things is the title. So the title is normally the thing that draws most of the people. When they read the title, they then get to be caught up with that, and then they want to see exactly what this is all about. So these are just typical examples of some of the titles. So it's a concise, descriptive, that captures the focus of the research or the project. So you're actually trying to describe some of the stuff that you did. So these are some of the typical examples. They ended up becoming articles that were published in different, the first one is a local journal. The other one is an international journal for AIDS. And then this one is around community perceived barriers to uptake of health services among men at Citibank district in South Africa. Simple, straightforward.
Why did you put the one from the state?
Okay. We do have one on the far left-hand side, where we do have a co-author from the Free State. All right, so it talks about the transformative impact of community-led monitoring in the South African health system, a comprehensive analysis. Now, don't worry about the terms and all of that. Take note of one thing. In all of these, it's not just me alone. It's me and the other team members and the other team members and the other team members. So we bring people together. So which means this one is good at crafting the title. This one is good at reviewing. This one is good at the first draft. That one, epidemiology, statistics, and what. But you can't even work as part of the team, but likes being in the background. But all of those people, they end up being part of the team. That one, on the other hand, has got in-depth knowledge of the community and what is happening at a community level. So there is a part that says that you cannot do it alone. You need a team to do that. Because the article writing process is a very lonely and a long process. There must be someone who commits to say that I'm going to make sure that I push this team from the beginning to the end. I craft this idea, I put this idea together. And then there must be people that are playing different roles in the article writing process. And once that has been done, you then submit it for peer review. Just like abstracts, they get to be submitted for peer review. And then when they're submitted to peer review, you get feedback, yes or no, you have been accepted or not. Some conferences, they give you feedback in terms of your weakness was around this part, but most conferences, they don't. But when it comes to articles, they give you heavy feedback. That when you receive it, you feel like resigning. Now, there was a part where I wrote my first article. My first article was something like 20-something pages. But I got feedback from 6 reviewers. And that feedback was more than 30 pages. That's how bad the article was. And when I received it, So it came straight to my email. I looked at it. That very first weekend that was there, I went straight to the guy who was my supervisor. I'm like, look now, these people. Wow. I threw tantrums in their office. He looked at it. He was like, oh yeah, this is positive feedback. This is not bad. Just go and start working on it. I looked at him. Remember, this is my first article. I've never written an article before. It has taken me a long period of time, to put that thing together. So there is a part that says that at that particular moment, that is the support that he could provide me and the motivation that he could provide me. But from there, I learned a lot through that exercise. And that article has turned out to be one of my most cited papers. Because the first thing that I wrote and what later on came out was two totally different from what I had initially written. So there is a part that says that right now you've got an idea that we're going to talk to say, you know what, this is what we do and this and this and this. And then from there, we will take that idea, we synthesize it, we put it nicely in proper, technical. And then from there, we say, yeah, look at it. Then you read it again, you go like, no, but here, change here. Yeah, this is what I meant, but here, yeah. By the time now it gets to be accepted, by the time you go to the conference, you would have even come up with more brilliant ideas. That initial presentation, when you get to present it now, practically, you then add more flesh to it. But right now, I want us to have that confidence to say that, you know what, I didn't start where I am right now. I was even struggling even myself to put together abstracts. And I did most of my research from community-based organizations because I've been working in the CBO space. So for my master's, I used CBO data. For all the other studies that I've done, I've been using community-based organizations data. And I use organization data of where I will be working for ease of access to that particular data and for relevance to my manager so that I can have the buy-in instead of going to his organization like, how? Why do you go that side? Do you want to, when my contract comes to you, I'll be chopped and go on that side. So those are some of the dynamics that you need to be looking at when it comes to crafting this work. All right, this is just to give you another idea of, so there are different formats of abstracts. It varies according to conferences. Never be intimidated by that. And we're not going to go into those kinds of detail around those variations. We're just going to go into exactly what we want to tell the people. When we've gone into that, we then say, how do we do it? Is it background, methods, results, and conclusion? The background is the description. The methods, how you did the work. In some cases, that's why you bump on words like qualitative and quantitative. But we are not going to talk about that. We don't want to talk about that. You are going to tell us to say that, we had a dialogue. At the back, it will be quality. You see? So, but the discussion must be, we had a dialogue, we had a discussion, we visited so and so, we did a survey, we did this, or we just were discussing, it was the three of us, then from there it led to this, it led to this. There are scientific terms for everything that you are currently doing. And that scientific terminology is the one that serves as a gatekeeper to most people not jumping into the research space. And that is why we are coming to say, no, guys, that scientific jargon, we know. But what we don't know is what you know. And what you know is more valuable than the scientific jargon. Because with the scientific jargon, I cannot write. But with what you know, you can kickstart the writing process. So let's meet each other. Let's collaborate. Let's understand the methodology. Halfway along the way, you find yourself explaining those methodologies. And then from there, it will be the results. And then it will be the conclusion. Then, of course, in terms of projects, this is where most of it's around the background, which is a short statement, the actual intervention, a description of the project, or it could be an experience that you went through, or some of the lessons learned, and the conclusion. Just to show you a step by step, it goes back to that thing to say, when you are writing, you write your 1 or 2 sentences to explain the topic and purpose of your research. 1 or 2 sentences. 1 or 2 sentences to describe your method. 1 or 2 sentences to talk about your results, lessons learned, and findings. 1 or 2 sentences about your conclusion. Now, right now, we're not going to work on that, like I said. We're just going to work on exactly, what are we talking about? What are the challenges that are there? and how have you been doing that. But when that has been done, we'll then synthesize it and summarize it. Because we know that there is a lot that is happening, but your challenge is actually summarizing it. And then the forces of abstract writing must be complete, concise, clear, and cohesive. So complete, it covers the major parts. So like I said, you pick on one component and you zero in on it. It must be concise, it contains no excessive wordiness. So you don't have to be wordy, you don't have to, use lots of words when you're writing, because it's just 300 words. And it must be clear, readable, well organized. No need for technical jargon. So when you are writing abstracts, there won't be any need for technical jargon. And then it flows smoothly between different parts. Then when all of this has been done, the abstract goes for review. Here, they look at, is there a clear background and justified objectives, right? So if it's something that you have already been doing in your community and it has led to some change within, in some cases, it's something that you have been doing in your community and has not led to any change within your community, you still need to document it and say, these are the failures that we've had in our community. And these are the challenges that we've faced and that kind of stuff. Is the program or project or process of design or implementation appropriate for the objectives? We will make sure that it is appropriate. Are the lessons learned or best practices important, supported by findings? Make sure that that alignment is there, where the lessons learned and best practices, they are aligned to your findings, right? So that element of alignment will make sure that we assist you to get that. Are the conclusions and next steps supported by key results? So these are some of the assessment criteria that they use when they are now going through your abstracts, when you've submitted them. Because remember, you submit, then after submission, they then take them, they give it to a panel of peer reviewers, who then go to your abstract, and then from there they read it, and then from there they say, this one, let's give them 5 out of 10, this one 7 out of 10, this one. And then with those scores, they average them, then they give you a reject or an accept letter. And then is the work reported original? Definitely. Whatever work that you will be doing, no one has ever documented it in your community. Because there is scarcity of information from your communities. You will find that when it comes to proposal writing, there is always these questions around, has your project been evaluated? Has it been documented and disseminated? Or there could be a question around, how do you document and disseminate your project? Or how do you use your M&E data? Sure.
Tell me, how do they verify or how do they determine that your project is it factual and precise? As they go through your abstract.
Yeah, and that one is personal perceptions. They will look at it and then they will see it. Okay, the information that you have provided, based on the information that you have provided, they will then look at it. Is this factual? In some cases, people make like some mistakes in the process of putting together that particular abstract, or they put in certain things that end up not making sense. Like at times, people would say, I used mixed methods, but when you read down, you find that they used only qualitative, or they did only dialogue. That on its own, it will sell you out. In some cases, they say, I did qualitative and quantitative. But actually, when you read, you don't find qualitative and quantitative data. So that's some of the things that when they look at it and like, there's something that is wrong. But in some cases, people just use their intuition to say, no, man, this thing, this just doesn't make sense. So it varies from one reviewer to another. But the basic things is around, making sure that things don't make sense from the title. There's a linkage with the background, the objectives, and then the methodology that was done. To say that, does this methodology actually link to this particular aspect? And then the results, they must show that if you have said quantity, which is numbers, it must show numbers in your results. But if it's more to do with stories and dialogues, it must show that, okay, these are the themes that were coming out from there. So that alignment is very key. Presentation and meeting must be, so there's a part that says that when all of this has been done, you then go and make presentation. Must be comprehensive, must strictly follow format, content rules, and must be neat. So there's a part that says, as we do our work, we're going to be given specific guidelines in terms of how to put together abstracts, how to put together poster presentations or oral presentations. We need to follow those particular guidelines. Some conferences, they even give you templates that you need to follow. Must likely include implications, which is always key to say that policy implications. Remember, we do all of this work because we want to influence You know, it might be in one district, but we want to take it to other districts at the end of the day. We don't want the situation, and we want to be the ones that are leading that process of taking it to other districts. So you don't want the situation where by now you wake up one day and now best health is one that is going around and just say, you know what, the best practice model is like this and this and this and this. You want the situation where by when you have been given that opportunity, you go in. Some conferences they publish, like the International AIDS Conference, is going to be having a late break opening soon, providing opportunity for feedback from others in the field. Then the poster, once accepted, begin early. Trust me, when we get to know that these have been accepted, we'll share that information with you and we'll guide you in that process. So that particular process is automated. We'll guide you in that process. We assist you to put together the presentation. We assist you to put together the posters. All right. For the previous years, we have also been assisting in terms of printing of those particular posters, because we know that not all organizations would have resources. So we go out and mobilize resources to provide you support. We might not be in a position to cover your travel and all that, but there's a part that says that we support you so that you'll be in a position to get to some place. And then you can also add references where appropriate, submit stuff for printing. Also, registration and travel must be done early. And then the other part is around reading. Read your abstract and make sure it's a standalone. I'm going to jump to show you, this was the previous conference. These are typical examples of abstracts. So this was at the PASA conference. It's now being presented, where you would find that it has got 1 or 2 sentences. Yeah, it's 2 or 3 sentences. That lessons learned, it's also 2 or 3 sentences. This is now the actual presentation. And then from there, we've got an advocacy message, which is 2 sentences. Now, this is an abstract that's going to be accepted, and and then from there, this one is some of the work that we're doing as Best Health, but we're doing it collaboratively with other organizations. In as much as Best Health is implementing the program, but we do it with other organizations, and then we list them there. And then we go on to acknowledge funding agencies and collaborating partners that we have. Here is another one. This one was done by a community-based organization called YMCA, and also 1 or 2 sentences. There is 3 or 4 sentences, and then lessons learned, and then advocacy message. And then here is another one. This one was to another previous conference that we did. More to previous conferences. This just shows you like this, we're doing modeling. So not only do we do qualitative data collection, we also do quantitative data collection. We do human-centered design. We do modeling techniques whereby, we come up with, we use statistical software to analyze data to try and come up with some understanding of what is happening on the ground. And then this was a presentation that I did for the PASA conference, and actually this presentation is one of those that sparked that element. It was we got an award for the best presentation for this particular conference, and then from there we started pulling in more organizations to say, you know what, guys, let's go for this. The background, 1 or 2 sentences. The interventions, you see, it's like 3 or 4 sentences, and then you put in your diagram. Yeah, I'm trying to show you like how simple the process is. Remember, we're gonna sit here, you will tell us your ideas, we will all discuss, and then from there we come up with something, and then from there when it has been accepted, support you in that particular process so that you prepare for presentation. So with this also, it allowed for putting of pictures on the presentations, because it is an oral presentation. So you get there to showcase your work and how you're doing it. And then the methodology, how it was done, the screening tool. This is a Department of Health screening tool that we picked from the guidelines. And then we used that. So the basic project here was that we've got a Google Forms that we have with those questions. And then we share that Google Forms with those questions. But at the end, we ask the person to say that, so we say, have you had sex with a partner who has HIV? Have you had what? Have you had what? And then at the end, would you like to be contacted for PrEP, or would you like to be contacted for more information around this? So that's how that is the intervention that we're coming up with. So we're sharing it in WhatsApp groups, and then from there we went on to talk about the people that completed the tool. It was 79, 37 were part of the group, that initial group that we shared, and all of that going in that direction. It's very simple. Lessons learned: the use of WhatsApp and social media could be effective in increasing prep knowledge, interest, and possibly uptake among men in MSM.